Another procedure that you've been hearing a lot about is the thread lifts, and people have often been asking me what is a thread lift and how does it help and how does it work. What is the use of a thread lift? So the thread lifts, as I said, because when you don't need to excise skin or early signs of aging, or we just have a small area which is basically the malar pad of fat which has come down, or there is development of the jowls, you need to lift them without going in for a full major surgery. Then you can do a thread lift. You put in 4 to 6 threads and then you lift it so that it brings all the structures back to where it should be. So that is how a thread lift works, and because there are no major cuts anywhere, so the recovery time is faster, though you still have a recovery time for these procedures. In our Indian patients, we see that we need a lot of our faces tend to sag rather than wrinkle. In Caucasian skin, the skin is thinner, and so the wrinkling appears much faster, and they have a lot of excess skin which needs to be removed. So the facelift works very good for them. But for our Indian skin and Indian conditions, our faces are heavier, we have a thicker dermis, and that is why we tend to sag more rather than actual wrinkling of the skin where there is excess skin. In the sag, it's basically the ligaments which are becoming loose, and there is loss of volume which is causing the face to come down and become more squarish. So what the thread lift, we do the suspended thread lifts, is it pulls the skin up and it gives you a more triangular look. So it is just to reposition everything back how it was. So it just pulls it back like this, and then it repositions the jowls, repositions the fat, repositions the fat pad to pull it back into where it was. The advantage being that you don't have any major cuts, and you just have two small puncture marks here from where you're putting the threads in, but you still have a downtime. So it takes about a week. When we are doing the threads, we tend to overcorrect, we pull it back as much as possible, and then in a week's time, as the swelling relaxes, then it comes back to how it should be, and we do some minor adjustments if required after a week to see that everything is in place. So if you are doing a thread lift, you have to give yourself that 1 week. You can't have any event or a procedure, or you can't have a shoot during that time. So here you can see how the threads are going to be inserted. So this is a small 1 to 1.2 millimeter incision in the hairline in the temporal area. So we isolate and identify the temporal fascia there. So that is a covering of the temporal muscle, which is a chewing muscle, and that acts as a rigid fixed point for the threads to be fixed on, from where we can suspend the rest of the face. So this is one needle which has been inserted. These are hollow needles. Finding the right depth for the insertion is correct at the right plane is important, because that is when your tissues engage and are held in place. And you can see the markings that we have made in when the patient is in upright position. So we identify the vectors in which the pull is required, and that is how we identify where and which are the positions that we need to put the threads in, so that the face can be suspended to reverse the signs. So here you can see both the needles are in. So this is for the mid face, so the temporal vector. So this is from the malar area to the temple, and now we're going to insert the threads in. So the threads are basically their sutures made out of PDO, and you can see the purple color, which is typical of a PDO thread, and this will be inserted. These threads have small hooks in them called barbs, and these barbs engage the tissues and pull the tissues up, So when we are inserting, you have to be careful that the barbs don't get engaged in the hair or in the gauze, which might push the gauze pieces inside and cause infections. The problem with the threads again is you cannot put in too big a thread because then it would be visible, but if you put too thin a thread, then that it'll break. So finding the right thread for the right face is important. In very heavy faces, we might add a few more threads to give better suspension and better strength. So here you can see the threads have come out into the opposite direction, which are now being pulled. Now the needles are removed and the thread now sits on the So here we are going to be deploying the threads. So as you saw that the barb threads are already fixed at the top, and now these ends come out at the cheeks and in the lower face, and this is how we pull the threads and we engage the tissues onto the barbs which are there, and we overcorrect it and we pull the tissues back so that they are engaged into the tissues, and as you can see the tissues are held in place, and we overcorrect it, and then once the swelling settles down it falls back into position, or we might have to do a minor adjustment in a week's time. So that is how the deployment of the threads is done. The procedure is repeated on the opposite side as well.